What we learned over time in not just setting up Salesforce for our uses, but in maintaining it and upkeeping it with the various changes is that we had to have an external development team. That's a pretty hefty resource for any organization, but in particular for a small nonprofit that's trying to be light and nimble and focus our resources on our members. So having to fit into a roadmap of a developer and have extra people to deal with that on our team just became a burden. You know, Salesforce is a very robust platform, and you're able to configure it the way that you want. One thing that we learned pretty quickly was we had to, and I say this very endearingly, we had to Frankenstein the system. We were on a particular phone system, and we could integrate that, which was really wonderful because it was designed for call centers. But we had to find another technology for the text messaging. And then we had to find a third technology for video. And then we had to make sure that all of those things not only were integrated into the platform, but were integrated into the mobile app. All of that combined was just a big lift. Now within Welkin, the phone and the text are native. They're integrative. We don't have to do anything additional to that. And now we don't have these different modules that we have to navigate. Everything is in one place. Having been in two different platforms for digital health, Salesforce and Welkin, you know, the number one thing that we've learned through this process is starting at your member or your patient and their problems, and then working back from that to figure out what's the technology that's going to help them. I think a lot of people in my position who maybe are the technologists in a company or the innovative folks, we start with these big grand ideas of how we think it needs to be. And we look at the shiny technologies and we go, that's cool, let's use it, without assessing it in the perspective of the people that we're serving first. Because if it doesn't work for the person that we're serving first, and then if it doesn't work for the care providers, then it's not necessary. So that's really the heart of this. And what we found with Welkin is it really allows us to do that because a lot of the design is based on the individual, the person that we're helping, the person's behavior that we're helping to try to change. And if our coaches aren't being disrupted by the technology, if it's not a shiny ball, then we can focus on who we need to focus on, and that's the people coming through the door every day.